I'm going to go ahead and introduce our speaker today, Brianna Knight. Brianna married into the Army life and is a mother to four beautiful girls. The inconsistency of military life encouraged her to pursue her scholastic career online. She received a Master of Science in Human and Social Services in the beginning of 2020. Her heart has always steered towards helping others. In mid 2019, her oldest daughter experienced a trauma, which led Brianna into the world of in home care. Moms in Motion has given Brianna the ability to put into action her heart's desire, scholastic knowledge, and pursuit of helping reduce stress for others in situations similar to hers. She is honored to have the opportunity to serve and empower others. So welcome. Thank you so much for your time
Yes,
and being
thank you
with
for
us.
having me. I'm excited. So I'm going to share presentation. It's not super long. Let's see. All right, can you see it? Okay.
Yeah.
Yay. Okay. So we are Moms in Motion at Home Your Way. We're very, very excited to be doing this today. We have two names for our organization. At Home Your Way provides services for anybody 7 or 18 and older, and Moms in Motion provides services for all the kiddos 17 and under. Our organization was actually started by a mom who had a kiddo who got a disability diagnosis, and she just kind of dug in and found any resources available to her. And she stumbled upon Virginia Medicaid waivers, which is a lot of information that doesn't make sense. So she dug through it until she understood it. And then she found herself helping over 300 families in her home, and realized she can't do this herself. Everybody needs to know about it. So she started an organization, hired some friends, and got it going. The cool thing about her is that with this organization, she made sure that it was very specific. She understood the anxiety, the intimidation that Medicaid waivers provide. So unlike a lot of organizations like ours, she starts from the beginning of the process, not just after somebody is approved for a waiver. So she brings relationship to the individual in need and their families right away from the beginning. We want to get to know you, what's important to you, what's important for you. And we want to make sure that that remains our focus throughout the entire process of your interaction with us. So there's a few different types of waivers. The first one is developmental disabilities, and that one, you have to have a diagnosis by the age of 22 of a developmental disability or delay. Anything after the age of 22, you don't qualify for this. There is also a very long wait list for this, and it's prioritized by need, not by length of time on the wait list. So we definitely encourage any individual who's got a diagnosis of a lifelong disability to get on this as soon as possible, so that when that individual becomes an adult, it's much easier for them to have already been on it, already in the process, already in the system. While you're on that wait list, you can still get the Commonwealth Coordinated Care Plus waiver. This is no wait list. Diagnosis can come at any age. So this one works for children and adults, and it provides a lot of the same supports, just not to the extent that the DD waivers do. And all of these are based solely on the individual needing a waiver's income. So it's not household, it's dependent completely on the individual who's going to need the waiver's income. Additionally, if you do not qualify for the waiver, but you have that diagnosis of a disability and you qualify for regular Medicaid, you can go through the early periodic screening, diagnostic, and treatment program. And that screening is just done through a doctor with that diagnosis, and you get some of the same supports and resources, not even close to as many, but it does cover such things as doctor's appointments, medications, transportation, and having somebody come into the house and help care for the individual in need. So the cool part about our organization is we're completely free of charge. We help people through this process free of charge, no problem. Just come call us, ask all the questions you want to ask. We have a family resource specialist team. We call them FRS. And they know all things waivers. They know all things about the entire Commonwealth. So they're kind of like our gurus with Moms in Motion because they have that knowledge, not just pertaining to their locality in the Commonwealth, but for the entire Commonwealth. They're awesome. They assist families from the beginning. What is a waiver? What are the places that you would go to if you need a waiver, especially it's dependent on what waiver type or where you live as to where you're going to go get a screening done. What is a screening? We'll walk families through that entire screening process before they do get a screening done to make sure that they're not anxious or intimidated by it or overwhelmed, because it's important if they need these services and resources, if they need that relief, that they get the information that they need to make sure that they're getting everything that they need. But what are you going to do if you don't understand it? You're just going to kind of walk away. So we want to make sure that it's simple, it's easy to understand, and that families aren't going through the process by themselves. We're there for the entire thing. Our organization has been working to bring this information to individuals all over the Commonwealth since 2009. And we quickly became the largest provider in the Commonwealth. I attribute this to our owner. She's very personable. She's about the individual and she's about the families. So she looks at all the information. What is important to and for families? She takes that, that's our starting point. She takes that and then she does outreach with state legislators, with the Department of Medical Assistance, with everybody else, therapies, doctors, it doesn't matter. She wants all the input that she can get to compile the information and provide the best resources possible. Sometimes that comes in the form of our leadership, creating petitions and advocating for these individuals. So it's just really important to her to make sure that the best resources are available to the individuals with diagnosis of a disability. So up until that point, or this point, that's not technically what our organization is supposed to do. We're supposed to come in after an individual receives approval for a waiver. So all of that's just kind of a cool little bonus that our owner wanted to make sure she had in there so that families aren't deterred from obtaining waivers. So once they get approved for the waiver, that's where we come in and we help them determine, is it going to be best for you guys to go through an agency and have someone direct the services for you? So they'll make all the decisions. You really don't get a say in much what happens with that process. And sometimes that's most beneficial for the individuals and their families. But if they decide that they want to go ahead and take control and be in charge of the whole waiver process, that's where we step in and we help them learn how to be their own boss. We're kind of like their assistant in the fact that we do all the paperwork. We hold monthly meetings with them to make sure that all the resources being used are documented, that they're being effective, that nothing new comes up that they need, or they're not getting a service that they don't need anymore. So we want to make sure that everything is effective for them and they're getting the proper supports and resources. But on top of that, we also want to make sure that they're not being taken advantage of by the individual coming in the house to care for the individual on the waiver. So we look for instances of Medicaid fraud and we make sure that that individual is actually working when they're supposed to be, doing all the things, and that they're beneficial and that they're supportive and doing what they're supposed to be doing. All of this is done by a service facilitator who's scholastically accredited, of course, but the coolest part about them is that almost all of them have a loved one on the waiver. So they know all the things. They know where your anxiety is going to come in and what questions you're going to have or what's going to be important throughout the process. One of the things that a lot of people don't think about is the insurance company or the managed care organization that Medicaid is going to provide you once you're approved for a waiver. And our service facilitators, they think about this. So they're going to look at it and say, okay, what is important for you guys? This pediatrician works with this MCO, but this therapy doesn't. So which one's going to take precedence? And we're going to get you assigned to the right MCO or insurance provider through Medicaid to get you the best resources available, your most sought after, the most beneficial. With that being said, we also want to make sure that our service facilitators are not biased or generalizing or stereotyping based on their prior experiences or based on their knowledge of certain waivers or MCOs or any of that. So we put them through person-centered training to make sure that they are being individual and family specific to everything that they do, that it's about the family, it's about the individual, where they're going with their experiences and not our own. So they'll do this through their monthly meetings with the individual and the families. They'll meet and they'll make sure all the resources are being used. They'll train the person in charge on anything that has changed, or they provide updates on everything. If the individual in charge has questions regarding things, that's the time when the service facilitator will help them, walk them through any processes that they need clarity on. We also work with the fiscal agent or Medicaid's payroll company for the individual coming in and providing care for the individual on the waiver. So we pretty much do all the businessy side of it and simplify it and clarify the whole Medicaid waiver process for individuals and their families to make sure that their needs are being met, but without putting so much on the individual or their families. Typically, the decision-making person in the beginning, they do have to go through the paperwork with our service facilitator of, the whole application process of Medicaid and all the paperwork, and it's a lot during that first meet. But then we just kind of break it down each month and give you a little bit here, a little bit there, because you don't have to know all the things right away, even though we're going to tell you them right away in the first meeting. But then we'll slowly just kind of get it in, put that knowledge in there, drop it in each month, give you a little bit at a time so that you slowly learn the things without them becoming part of your everyday, part of your norm, because individuals and families, they have jobs, they have families, they have hobbies, they have their whole life, and Medicaid does not need to become a part of it. When families are approved for the waiver, it can be paired with other types of insurances. So sometimes it's the secondary form of insurance, sometimes it's the first or the primary, but it does help with doctor's appointments, traveling, mileage reimbursement, incontinence supplies. One of the coolest things that I like about the waiver is that it provides up to $5,000 a year for every waiver recipient. And this goes towards environmental modifications for houses, for cars, or assistive technology. The hard part with that is that there is a process. But my big thing with that is your insurance is often telling you, no, you can't have that ramp, you can't have the grab bars. We're not going to give you a GPS tracker because somebody is there watching the kid, that type of thing. Whereas this process, even though it might take, 6 months to get the thing that you're trying to obtain, at least it's getting covered. The process is definitely worth it. And you have, your support coordinator or care coordinator and your service facilitator working together to get it as smoothly as possible for you. We ask that if you see an individual who's got that diagnosis of a disability or their family, and you see that they're struggling and they could just use the benefits and perks of these waivers, just have them give us a phone call and see if it's right for them. If it is, or if it's not, it's just a quick conversation, nothing, no cost to them, nothing like that. So, but if it is right, then we get to break it down in simple terms so that they're going to get the help that they need without the overwhelming part of it and the intimidation. Now, the entire process with us, from the first initial phone call of, hey, what's a waiver, to having somebody in the home being paid to work can take up to 8 weeks. The process itself pretty much looks like you would call us, we would learn about you and help you identify what waiver type is going to be appropriate for you. Sometimes it's getting on the wait list and getting CCC plus waiver. So we'll walk you through if what's right for you. And then we'll give you the number for setting up a screening. We'll walk you through what that screening is going to look like. And then after that, you're going to get that screening set up. It's typically done within that week. And once the screening's done, then you call us and we'll set up our next meeting for us to come out and start doing all the paperwork for you. And with the approval, the waiver approval and the paperwork submitted, then you determine, are you going to an agency? Do you want to stay with us? Do you want to go with a different consumer directed facility? Kind of at your discretion, what's going to be best for you. If you decide to stay with us, that's when we start setting up our monthly meetings. We introduce you to your service facilitator who's going to be with you throughout the entire process every month. And they're going to help you identify who's going to be a good fit to come into your house and help take care of the individual. This can be a family member, a friend. You can put an ad, which we help with that as well, out if you need to get somebody in the house. And then we'll walk you through all the paperwork of hiring them, of the whole process. So from the initial screening to getting an approval, we typically see a turnaround in that within 2 weeks. You'll have that approval and all of the insurances and all of that being set. Now it takes about 4 weeks in itself just to get the background checks done on the individual coming into the house and working for you. So it can be 8 weeks. Honestly, it sounds like a lengthy process, but when you're in it, it's really not that long. It's especially if you've gone for so long without the services, or if you're new to this, you still gotta get a lot established in your home, your new norm, and then bring somebody in to help out and get paid to help out with that new norm. And that is pretty much it from us. Any questions?
I was curious, do you have anyone that can speak like Spanish or different languages and stuff like that? You probably use like a language line or something like that for.
So for initial contact, yes, our FRS team does have Spanish, Spanish speaking person on it, and they're throughout the entire Commonwealth. So anywhere in Virginia, they're able to speak with them. I suggest if you have somebody who has that need, they need a Spanish speaking person to speak with, to go to our website, and in our About Us tab, there is a referral link. Click that and fill out that information. Honestly, I suggest it for anyone though, because you can put everything in there, and then when they reach out to call you, they have everything ready for you. So it's the easiest conversation possible. We're already prepared.
And
But
it's the referral
yes.
tab. Okay.
Yep. So About Us and then the referral.
Okay.
Yep. And but we do have Spanish speaking persons. The hard part is anything past that. We do have language barriers for everything else. However, when people are approved for the waiver does provide interpretation services. So they can pull an interpreter and pay for it for any meetings that you have.
That's good.
Yeah.
I have a question.
Oh, I'm sorry, Miss Yantas. You go.
Oh, sorry. So hi, I have 2 kids on the waiver. We do consumer directed, and I was just wondering about, like, do you have resources for finding help for finding providers?
Yeah. So what you would do is, are you with our company or do you have a service facilitator?
I do have a service facilitator, but that person is not in this area at all.
Okay.
Physically not located in this part of the state.
Okay. So typically our service facilitators are local. Like I don't have access to the resources that they do, but they have, each division of the Commonwealth has their own little joint resources. And that's pretty much a mixture of what's been effective for the families that we serve, but also who accepts Medicaid or who accepts what type of insurances. So we don't just have the resources available for Medicaid specifically. So also if you have other forms of insurance, primary insurance will help. We can also help you direct you to who accepts those or who accepts Medicaid, but ours are very specific to each division.
If there's someone that is in our area, if I'm happy to help, like get that contact or pass it along to or any listing. that they could provide.
Thank you, Brianna. It was very good and helpful. Thank you for coming today. I have a question. Actually, I have two questions. One is that you said that you are helping with authorization for personal, to get authorization for personal care for individuals with disability, right? So my question is that, well, it's obviously depending on the needs, but how do you define the needs? Is it based on the Medicaid guidelines or that infamous grid that they have, like 15 minutes for shower and that's it?
Right. So that's actually a really good question. It is solely based on the needs. So when you go to apply for the waiver, that's part of the screening that they're going to do, and they're going to ask you all the questions. Most specifically, what activities of daily living do you need help with? A lot of families don't get approved for the waiver because they don't really understand how to answer that question. Yeah, I help my kid take a bath, so 15 minutes. But what they're not saying is that they can't step over the edge of the tub without being at risk of falling or having a seizure in the tub. They need constant monitoring. Can they control their temperature, that type of thing? So the amount of hours that you get for personal care through every waiver is completely dependent on how much help they need, what the diagnosis of the disability is, and if there's any medical nursing needs. So they take those three criteria into effect, and a reviewer will decide how many hours that you are allotted. Sometimes you get great reviewers who give you the appropriate amount of time. Other reviewers are very stingy. So it just kind of goes based off of all of that together.
Because we're often getting requests from our patients' families to complete this form. I'm sure you've seen that is Medicaid form.
Mhm.
And if you calculate the adjusted time from this Medicaid form, it's really not much, even for kids who are totally dependent for all the care. So in the situations when the patients have the waiver program, then they can get more hours, right? On the top of what Medicaid allows.
So
Do I-
yes. Yep. So one of the things that our service facilitators do, it kind of sounds like you're talking about the EPSDT screening form
Yeah.
that you would do. Yeah. Okay. So even with that one, waivers or EPSDT, our service facilitators are in charge of creating a justification based off of what you've provided through that screening. So our justification for when we're requesting hours for individuals is completely based off of what, for EPSDT, what you've said. It has to match the amount of hours that the doctor allocates for each activity of daily living. So that's kind of at your discretion with that. However, if they were to get on a waiver, then it would be solely dependent on what we've written in the justification.
Mhm. That's great. And another question I have, and I don't know if you can answer that, so I apologize in advance, but I still have a hard time to understand for our patients. I mean, once they have the Medicaid, then understand the process for them to apply for waiver program. But often it's that initial step, how to get the Medicaid. And I know that some families have, they may have commercial insurance and then still have Medicaid. So how to help the families to understand that, or is there an option to get the Medicaid just based on the patient and not the family income?
So that's exactly what the other waivers are. So CCC Plus is probably, it's the one that most people go to because of the wait list with the DD waiver and because EPSDT is based on a household income. But if they go for the CCC Plus, that is solely on the individual with the diagnosis, their income only. So you can have a 6-figure household income. If it's a kiddo who has no income, they're doing it based solely on that kid. And so they're going to qualify from the financial aspect of it, definitely.
But do you have to have, like, I know that, for example, in Maryland, there is a similar program to the waiver, it's called RAM. So, but you have to be qualified for Medicaid first in order to apply for that RAM program. And there's a very strict criteria of who is eligible for that anyway. But do you have to have the Medicaid first? No.
Nope. And that's the part that we'll help walk them through. If they call us, we'll help them with that, understanding that first we want to identify the criteria for. So for CCC plus, you need that developmental diagnosis, the disability diagnosis. And then you also have to have a medical nursing need. We see kiddos with autism a lot. They cannot self-assess or monitor, and that is considered a medical nursing need in regards to getting a waiver. But a lot of people don't think about that. Parents don't think about that. And the screeners, they can't prompt you. So you have to have that, the diagnosis, you have to have at least one medical nursing need, and then at least 2 areas or activities of daily living you need help with. So that's the criteria for the CCC plus waiver. And that's where our FRS team will walk them through that. So we help them before they even get that qualification of Medicaid, and the screening comes before they have to apply for Medicaid. So that's the first steps with us. That's what we'll explain throughout that whole process.
And in regards to the nursing needs, usually, from what I understand, it has to be some type of medical necessity for nursing, right? So the kids who, say, have a trach or ventilator, it's obviously, or kids who have gastrostomy tubes or something like that, or I don't know, whatever other actual medical needs. But we have a lot of outpatients, particularly kids with the cerebral palsy, who overall are very healthy, and they may eat by mouth, they don't have any respiratory support or anything like that. But they are dependent for others in terms of their ADLs and mobility. How that nursing needs can be defined for those.
So you're going to look at that from what, if they didn't have this diagnosis of a disability, what medical supports would they need? So is there an ongoing medical support that they're going to need? For instance, do you have to see a cardiologist yearly, whereas somebody without that diagnosis wouldn't have to? That's a medical nursing need. Or asthma. Are you being managed for asthma? Is there a chance that you could have seizures because of your diagnosis? So it's anything that is an ongoing medical support that is a medical nursing need that wouldn't typically be there without the presence of the disability diagnosis.
Yeah, well, pretty much like 95% probably of our patients have a disability diagnosis. So
yeah.
But again, a lot of those kids are very healthy otherwise, except for their disability. And, disability doesn't define the necessarily health condition. So, all right, but I guess we'll just have to refer all of them to you guys.
I definitely recommend it, because even if it's not right for them, at least they could call and find out if it is. And our FRS team, they're super good at it, where they're like, they pry into their lives so much that they're like, hey, there's asthma. You didn't know that one, you didn't think about that, but yeah, that gets you on the waiver. Or they're really good at just getting to know the families well enough to understand where those medical nursing needs are that the families wouldn't even think of, because that's their norm, to them, it's not anything out of the norm.
Would bracing be a medical need? Like they need something on their hand or leg to walk?
Yep, it should be considered one, because are you going to have to see a specialist for that? Is it something that there you go. Do you ever need pain management for it? There's all types of things like that. That's exactly one that people
you need
don't typically
assessment
think
on
of.
your, like, wheelchairs or walkers.
Yep. So the big thing is it going to be ongoing? And that's the only sticky, tricky part is it going to be an ongoing? So if they sprained their wrist and they're trying to get on the waiver, that's not going to go. But if it's something that they're going to have to developmentally work with medically forever, most likely, then yes, that's definitely a medical nursing need.
And just to follow up with Dr. Morozo's question, so within the 2 weeks of contacting you, let's say the paperwork's done, this submitted, and you say, yay, you got the CCC plus waiver, and they have a primary insurance of whatever private, Cigna, Blue Cross, whatever it is, and then now they have this CCC plus waiver. So now, when do they actually get assigned Virginia Medicaid as a secondary?
So as soon as they're approved for the waiver, they get assigned automatically. And then when we go do that intake process, that's when we help them determine is what's assigned to them, is that going to work for them, or do they need to switch MCOs? So,
like
it's like an
United
automatic.
Healthcare, like United Healthcare versus Anthem Health Keepers Plus versus, and you assign that.
No, we help them with the process of figuring out. So Medicaid automatically will assign. They'll have, with CCC Plus, you have a care coordinator through Medicaid who a lot of people don't even ever contact because just some localities it just lost in translation, I guess, that they're even there. But they do have a care coordinator assigned to each waiver recipient. So we'll help the individuals identify who that person is and get them the type of MCO that they want to work with. But as soon as you get that waiver, you get assigned an MCO through Medicaid automatically.
And then I'm so sorry.
No, you're fine.
But sometimes it comes up as like straight Virginia Medicaid with no MCO. How's
with
that?
the Keep Pro, it's just how they assign it right away. So that's where we would be like, okay, well, they've just done the straight one. Let's go ahead and get you where you need to be. And that's one thing that we watch out for. So if you wind up staying with our organization instead of going to an agency or other places, that when we're doing that intake paperwork with you, that's what we're covering is this is who they assigned you, or it's straight or whatever it is. And we help you get to where you need to be.
But I thought that a few years ago when the Medicaid in Virginia were totally like reorganized or something, so everyone got reassigned to MCO, and we were told that straight Medicaid is not going to be in existence anymore unless you had it done before, or there is some very strict restriction or circumstances. Is it right?
Yeah, I think Lucy covered that at her last one where they did that switch. And I wasn't around for that one, so I don't really know much about it, but I do know that it was like there's certain forms with straight Medicaid, and then with the diagnosis of a disability, you typically don't get that straight Medicaid unless you're going through the EPSDT. So if they have it on there, you're just kind of in a waiting period is what that means. If you're on a waiver and it's straight, that means you're kind of in that waiting period, which means that somebody needs to get on it and get you assigned to somebody because Medicaid dropped the ball.
So we were on the waiver back when all that happened. We were first just straight Medicaid, and we had only the Medicaid Virginia DMAS card, the white one with the state of Virginia on it. And then they said, no, you can't be on that anymore. And they assigned us some I don't know, I won't say the name because I don't remember, but it was horrible. They had no providers in Northern Virginia, and we switched. We're on Anthem Health Keepers Plus. I do know our care coordinator. We're in very close touch.
Good.
So that's been helpful, but my understanding is, you can't, and the old straight Medicaid number is on the Anthem Health Keepers Plus card, but there's a different member. He has basically two different member numbers.
Right.
But we can't say we're on Medicaid anyplace. It's just, you have to pick one of those 5 MCOs. You're right. They just randomly assigned us one, and then we looked at all the features and we went with the Anthem Health Keepers Plus. I don't know if that was the right thing or not, but they had by far the most providers in this area at the time. And now we're Anthem Health Keepers Plus is our secondary. We have primary commercial insurance, and we use the Anthem Health Keepers Plus secondary.
Yep.
No Medicaid anymore. Nobody takes like straight Medicaid.
And just to go back to Mrs. Yantis' question too, we get a lot of questions about the caregiver support at home, if it's not the friends or family members, but it's an outside provider, that if they're not showing up, or if it's a nursing agency, they're calling in sick, there's not enough people. What are your thoughts on that, or how can we help that situation? It's in support the family.
COVID kind of hurt the personal care attendants a lot. Nursing companies, we've seen it all across the Department of Human Services board, especially here in the Commonwealth is one thing we've noticed. We're working with support coordinators, case managers, and they're just dropping like flies, and then new hires. And we have seen that has slowed down just a little bit. Honestly, the best referrals that we're having outside of family members and friends are coming from Facebook Marketplace and Indeed job search. So it used to be care.com was a good one, but now that one even hasn't been producing good results for a stable person to come in. So those are the two places where we're seeing the best outreach bring in good results for attendance, but it's still hard. I did a presentation the other day and the girl was like, I'm pretty sure everybody in the workforce has moved to an island in the Caribbean. And I like just forgot to tell the rest of the world. And I was like, yeah, that's what it feels like. But it is slowly starting to pick back up to where people are starting to come into the job force. But that's just kind of something that's happened, nationwide with COVID.
Mm-hmm. And should they call their Medicaid or coordinator or the case manager, or who should they contact?
So they can contact their care coordinator, who should be able to help. Some of them do, some of them don't. It's just kind of dependent on the person, really. We have some really good care coordinators who will help. Our service facilitators do that too, where they'll help you create the whole job description, put it out there, like walk you through the whole thing. And it's really cool that they do that.
Anything else from anyone? Any other questions?
Sorry, I have a quick question. Do you happen to know what the pay rate? There was a pay raise, and then I heard there was going to be like a catch-up payment or something for attendance. Do you happen to know?
For Northern Virginia,
yeah,
I want to say we went up to
15 something.
Yep.
Which is a little more palatable. It was like $12 for a long time. And the answer to why you can't find help is because it's not a living wage. I'm preaching to the choir here. But the best luck we've had, and it's sporadic, has been, somebody knew somebody, or a college student who was going into some kind of related profession or something like that. But the fact is, a lot of those are younger people, and they're going off and doing the next thing. And so you have them for a couple months and it's fantastic. And then it's you again. So that has been our experience. And we ditched the agency because I couldn't deal with revolving door and not coming and coming. And it's great when they came, but then COVID hit and we had 5 people a week coming through here. And I'm like, where are you the other 6 days a week? And we couldn't do it. And so it's just, thankfully, I'm very grateful. At least they made the parent exception thing where my husband and I, we have 2. So we're each employers of records and we're each attendants.
That's awesome.
But there's no break. So, that's life. We've been living it for 15 years, so we understand. Finding help is like the holy grail.
One of the other places that we do suggest to look is churches for, teens who are, involved in the youth and they need extra money because that, they don't need the insurance. They're still on their parents' insurance and they can come in and help out. But then there's they've also included the sick leave for attendance. So I know that they're trying to make efforts to kind of make it look more of an appealing position, but they're not doing enough. And that's where our organization, as well as many other organizations across the Commonwealth right now, are petitioning not only for parents to be able to remain attendants permanently, but we've also been advocating for, you know, the rights of personal care attendants, for them to be able to have pay increases, whether it's, you know, yearly or however it works out, not out of pocket for the people in charge, you know, decision making person, EOR. But so we're advocating to try to make that support a little bit better, a little more appealing to the public. But as of right now, that's just kind of in limbo until state legislation decides what they're going to do.
Well, this has been so great. Thank you so much, Brianna. Does anyone have any last minute questions or?
Thank you very much. Appreciate the information.
Yeah, you're welcome.
Yes, this will be very helpful to our patients' families. We'll definitely continue to learn and pass forward all this information as best as we can. I know I'm trying to bring up kind of waiver programs now at like every visit, or just scan like their insurances, seeing what, because it all affects them so much. And I don't think people always get that initially when we first meet them. Of course, there's a lot to go over, just like you said, it's overwhelming. But thank you so much. Your organization sounds incredible and so supportive. So I can't wait to pass along more information to our families.
Yes. Well, thank you for having me. I
Yeah,
loved it. It was good.
thank you guys, and thanks for signing in.
Yes. All right.
For
Bye, guys.